You need to subscribe. You need to get adjusted. This is the way.
He just threw up.
You need to subscribe. You need to leave a comment. You need to get adjusted. This is the way. Merry Christmas, everyone. Thank you for watching. See you in the next video.
Exhale. I got you. Other side for me. Good. There we go. Beautiful. Face up for me. Good. There you go. Tilt your head to the left a little bit. There we go. Good. Feeling lower back pain since you were 12?
Oh yeah, I've always had cramps in my lower back since I was 12, and it was always around the time of like my cycle, but now it's definitely around that time, but it even comes like with stress.
Go ahead and stand up for me. Just turn around for me. Where's can you take this outer coat off?
Yeah.
Where's the most pain? When you're feeling that cycle pain, where do you feel it the most?
Back here, and it like radiates down.
Into your glute.
Down definitely there. Like I can't sit flat on my like butt all the time.
Yes.
A lot of times I feel like I have to sit on a side.
Okay.
So actually when I'm driving, it kind of is uncomfortable, and I have to like lean over. And then like I don't know how to describe it. I feel like the muscles like down here, it radiates into those muscles, and that's why they said that they think I have pelvic floor tension myalgia, because it just makes it feels tight all the time.
Your left shoulder's a little high. I'm looking at your posture. Just looking at your alignment here. Your left shoulder's about a half-inch high. Your light 2. Look straight forward. We're dealing with about 2 inches. Your head's forward. So you're kind of, I'm exaggerating a little bit, but it's because we're gonna feel a right side of your neck is gonna be out of position a little bit. And it's because you favor tilting your head left. And if you walk around with your head tilted, it makes you dizzy. So you drop your shoulder to get we call it a righting reflex. We keep your eyes level. Now, when the head goes forward also, if you're here, your middle back should be relaxed. And as your head goes forward, you feel like it's tight here.
Yeah.
And so the more, the tension ultimately, I would argue, is from, there's a misalignment up here. Perhaps it started when you were young that caused your body to want to lean away from it. That caused your head to go forward. That causes the middle back to become tense. Your lower back, your right hip's a little high also, and that's kind of in going with your shoulder. You're in like a left avoidance. Your body's trying to, I'm exaggerating, but you're trying to get away from that left side a little bit. And my first goal, like I said earlier, is to go through and just clean your spine a little bit and just see how you do with going in there and asking everything to move, how the muscles are doing, how much lactic acid's in there. You know, and you said the TMJ also, I read on here?
Yeah, that actually started like a few months ago. I woke up one morning and I could not open my mouth further than like that. And I thought I got tetanus, because a couple days before that I had a puppy and I was picking up her business, put it into the doggy station at my apartment, and I cut my finger on it because the door like slammed.
That was it.
So I thought that like because I cut myself, I got like fecal matter in there, and I ran to urgent care. They said it wasn't tetanus, but they gave me a shot anyway. And now it just happens, like, even if I'm eating, I'll have to, like, you know, do some gymnastics with my jaw to get it to open.
The more forward your head goes, the more the jaw is jammed. So the head, your ear hole should be over the center of your shoulder. When I looked at you from the side, you're dealing with about 2 inches with your head being forward. Why? Because at a young age, again, we're told to sit and read and write, and we're on our phones, and how often are we stargazing or painting ceilings? And so we spend a majority of our time forward or down, and your posture is a compilation of wherever you are the most amount of time. And I can see that, like I said, there's going to be your neck is, we got to get that untilted. So on your back here for me. Take a deep breath in for me. Head back for me. Let it all go. Let it all go. Deep breath in for me. There we go. Exhale. Let it go. Chin down a little bit. Chin down. There we go. Deep breath in. Let it go. Exhale. Chin down. Got work to do. Yeah. Resistance. You know, they moved, but there's a lot of reluctance in there. You should have just an effortlessness. Just, you know, Ed, I didn't even feel like I was pushing that hard. Not trying to work. And if that area is tight, again, somebody else has to make up for that stiffness. If one area is stiff, there has to be an analogous loose area. And I looked at your MRI earlier, and we,
Yeah.
like I said, these areas look brand new, and just that last guide, L5, is showing some evidence of premature aging.
Okay.
Slide down, side facing me. Your bottom leg is gonna go straight, top leg's bent. There we go. There we go. Put your hands around your belly for me. There we go. I put the ankle behind the knee. There you go. A little closer to me. There we go. Put the back of your head in a little slit. So you're gonna turn your, hold on, I'm gonna put you, there we go. Turn your head towards me. There we go. There, perfect, you got it.
Okay.
It's like a modeling show.
Yeah.
Deep breath in, here we go. Exhale. I got you. Other side for me, good.
Whoa.
Exhale. There we go. Beautiful. Face up for me. All right.
I have a question.
So good, please.
Is it bad to? I have like a nighttime and morning ritual, like getting
Popping
in.
your own neck?
Well, no, I don't pop. I cannot pop my neck.
Good.
I refuse. But I do pop my back, like, and I do kind of what you just did,
Right.
like leaning over. And
Right.
should I stop doing that? Well,
So-
will it hurt me?
Well, if you're bending forward, you're pulling that arch. There's supposed to be an arch in your lower back. So if I showed you that video of me adjusting your back, I tried to keep that arch in your lower back. And
Right.
while I'm adjusting you, I'm trying to push that arch into your back.
Okay.
So if you're flattening out your spine or popping your spine, bounding forward and twisting or something, trying to, two things are happening. One, you're probably only adjusting or loosening the areas that are already loose.
Okay.
So notice how your hips, your SI joint, and your lower back moved very easily.
Right.
Right? And your middle back moved reluctantly.
Okay.
Right? So I almost want to focus entirely on that middle back because of how the disparity between how loose and how stiff those two areas were. Having that much stiffness in your middle back relative, now if your hips were stiff, then I'd go, okay, well everything's just, she's just tight, you know, but it was super loose down there. So
Okay. Yeah.
I don't think, and I can sort of tell you've been popping it.
Yeah, I accidentally did this morning right in front of my mom. I was about to drink my coffee. I was standing next to the kitchen island, and I just grabbed it and twisted. And I was like, "Wait, I shouldn't have done that."
Right, and
I
that's
was like, Dr. Ed was supposed to get that
right.
later.
Well, no, it's what's happening is that's what's putting further pressure on that L5 disc.
Okay.
So when you're bending like that, you're mainly L5 is fully going through its range of motion, and then all the other vertebrae are moving, right?
Right.
And so L5's the first to arrive to work and the last guy to leave, and you can get away with it at 21, but by the time you get to your mom's age, it just can become a problem where Ed, that area doesn't have any more tread left on it, and what am I going to do to make it to 100?
Right.
And I really have like a 100-year outlook for all my patients. I want you to be able to make it to 100 and be able to have a good quality of life and not. And so it's just way too tight up here. I can tell why. The issue, you can't pop your own neck in essence because this is so stiff up here, and we have to balance your neck a little bit here.
Yeah, I definitely feel that when I'm stressed, like the stress does cause my lower back pain, but I hold a lot of tension in my neck and shoulders.
Yeah.
I do catch myself like,
Right, raising them.
right.
Okay, I got you. Like I said earlier, there's two sets of nerves that go to your uterus. You have one set of nerves that essentially work as a brake pedal, and one works as a gas pedal. And if there's inflammation in your lower back, that can shut down the functionality of not only your digestive system, but also your reproductive system. And so the functionality of the organs ultimately comes from your brain communicating through these two sets of nerves. The medication works by trying to activate chemically this nerve. And I know you've been on, you said since 12, you've been on birth control.
Since I was 13.
To try to regulate your periods a little bit. And
I
help.
started on my first cycle when I was 12 and started birth control when I was 13 to regulate it because it would last for 2 weeks and it was so heavy that I developed anemia. My doctor was like, "This is not normal."
Right. Well, and like I said, they're looking at they're saying the right things, but then the treatment isn't. Let's get to the reason for why the brain is not properly communicating. And now, like I was saying earlier, it's almost like a third party now is involved in our system. We have our brain using its two conduits, and now we have a third party chemical that we have to try to figure out how we're going to have a long lasting relationship with all three members in there.
Right. And also too, I don't think it was the same nerve branch, but like the rectum was on there, and that's where a lot of my it's tailbone pain, but it radiates there. It really does affect my ability to like stand up straight, go to school. I've had to email teachers in the past and be like, "Hey, will you please let me know what you did in class today? Like I can't even drive."
Yeah.
And that's really frustrating, especially, and I'm nervous, going into a really rigorous nursing program. I'm not going to be able to keep doing that.
Right, we got to clean out all that. So the nerves work by a thing called sensitization. What happens is during your period you retain fluid. All that fluid builds up some level of inflammation, which then sensitizes the nerves. So you have the organ, the signals going to the organ are trying to ramp up, which activates the organs. You have all this inflammation in there, stress, and now and then plus a lower back nerve pinch, you know, or inflammation of some lower back nerves, and now we have an environment where you can actually be, you know, like I said, the sciatic nerves are getting aggravated. We have to try to desensitize everything, clean it all out. I'm going to be real gentle. There we go. Let it all go. Just this top guy. Here we go. There you go.
Yeah, that one feels like so
tight.
sore. And that's okay. Like, do what you need to do.
We'll get it all moving. Just this top guy right there. Let it go. Let me have it. There you go. Look at that. Beautiful.
Yeah, that felt good. I needed that. I have needed that in the past 2 years.
Just what happens is when the neck gets inflamed, your body tilts away from what hurts. If it's inflamed back here, your body goes into what we call Antalgia. So the only way to undo it really is to make the structures on the back part of your spine not so inflamed, not so sore, so that we can more comfortably have our head in the right position. But we have to counter stretch, so we have to take you back into extension to stretch what we call the anterior longitudinal ligament. So the long ligament from the front part of your foramen magnum down to your pubic bone that hasn't really been stretched because we don't do these deep back bends. And so that ligament being so tight keeps us pulled forward. So everything I do on the table here is to try to get the structures on the back to be able to slide together so that we can go deep enough to stretch that front ligament. And that's it. And then trying to clean all this out. I'm going real gentle on your neck and real quick. A mark came out.
Already?
Yeah. There's a
I'm
lot.
not surprised.
There's a lot in there.
I'm really not surprised.
Yeah, there's a lot in here.
Okay.
I'm not gonna go, but we'll get those shoulders in a second. But we got to get all
it
this.
It almost feels like little like shells under the skin or something.
Yeah, I want all that. God, I call it gristle, but it's like it's like a graininess that has to be gone.
It does feel like that. It feels
Yep, I want all that gone in there. Real quick, I'm not even going. I'm pretty gentle, even light with this gua sha. So it's like just running a pretty soft pass, and there's a lot coming out, which tells me there's a lot of layers in there.
Okay.
And you just sort of take them out layer by layer. It's like cleaning carpet. It's just a.
Have you ever been gua sha?
Never. I'm a licensed esthetician, so we do gua sha like on the face.
Your right shoulder is about. I'm looking at you on your back here, and your right shoulder is about half inch forward. I'm gonna check this out a little bit. Is that okay on your shoulder?
Yeah, I have bursitis on this shoulder.
Yeah.
I played volleyball for 9 years, so maybe.
We got to get your shoulder. I want the shoulders level first of all, but
Yeah.
at the very least, and we have to draw this shoulder back. What ends up happening is the glenohumeral joint, the humerus starts riding up on the ledge of the glenoid fossa, and what's we call the labrum is the edge of the cartilage, and then we call labral tears when if we pivot continually on the front lip of the glenohumeral joint, you end up tearing that labrum, and so everybody wants to talk about what to do about labral tears. We just reposition the shoulder, draw the shoulder back into the socket, and you're not going to continually. The bursitis is because your body's trying to put fluid to cushion that stress that's happening where there shouldn't be much stress. Right. So there shouldn't be. Your humerus isn't supposed to be pivoting all the time on the front part, but injuries or forward rotation of your head and shoulders.
Yeah, I played all around in volleyball, but the last few years that I played before I stopped, which I stopped in high school.
I feel that right there.
What is that?
It's a spasm in a muscle. It's that you've torn it and then it's healed. With
weird.
Spasm. Go ahead.
I played like outside or right side hitters, so it was just constantly like using the shoulder to hit. And
This is where the bursitis that she's saying is in there.
Yeah.
I can see it on your shoulder. There's the actual tissue isn't circulating properly, and that's
Okay.
the stagnation creates an environment where there's an acidity that present that causes pain or soreness, and a lot of this, I don't really get too worried about the shoulder because everything in here replaces.
Okay.
Everything's on a replacement cycle in your shoulder. The things that give me more concern, or what I put in different categories, are like the discs or the enamel on your teeth or your meniscus. You're saying
Right.
those structures don't really replace
Right.
like your shoulder can, like muscles can, and ligaments and the joints. You know, they're able to replace themselves. So I don't, oh my gosh, freak out. You know, it's like
Yeah.
just get the position fixed, help get the person back, stretch back. And so we'll be fixing this by, we're going to take your arm through all these ranges of motion, almost like a clock. This is called like 9 and 3 with both arms. I mean, you're saying you work all these angles, like right in here, a little bit more, a little tighter in here. You want to work all these different angles of your shoulder. And we do this usually in synchronicity with the back stretching. So when we get your back loose, we'll have a device in your middle back to help work on your lower back curve. And at the same time, you can work on trying to draw your shoulders back. Yeah, you got it. And it takes time. You have to sort of hold this for about 20 minutes, you know, and hands go numb, then you move it. But eventually,
It just cracked. Did you feel that?
yeah, it's back. It's almost level now with
Yeah.
that left one. But
Okay.
it was pretty. Let's see this TMJ.
Yeah, I was a gymnast before that, and I on my dad's side of the family, we just have like bad knees. So then gymnastics and volleyball I have tendonitis in both of my knees, and to do like long walking or running, I have to wear knee braces. Otherwise, I can't go. Like,
Point for me. Where do you have the most pain in your knee?
like right here, on top of my kneecap, like
Here
running,
or in here?
Inside.
Inside, on top of this.
Right. It gets like really sharp
Okay.
and
Okay.
super uncomfortable.
How about on that? You have pain on this?
Yes.
Okay.
Yeah, like yesterday, my mom and I went and took a walk at Nathan Benderson, and I didn't. I brought them with me, like here to Sarasota, but I didn't bring them with me to the park, and I kind of regretted not bringing them.
We got to clear that. We got to clear the quad. The quad is in contraction. That's
Right.
the muscle that, you know, and learning how to stretch that quad a little bit helped to relieve some of the tension on that cable. So that's the tibial tuberosity, is where, you know, that bump on the tibia is where all the quad attaches to. And obviously you're pulling up on that attachment point. The tendons dive through the bone, they make roots, and so that's what's creating that inflammation on that spot. And so we have to try to relieve some of the contraction of the quad, probably stretch the quad a little bit, and but let me fix this first.
This feels so
I know,
good.
I know.
No, it feels good. I feel like you're. No, that's good.
Got to release any. So the masseter gets all inflamed in here, and that's part of what can jam this jaw. Obviously, all the time, it's the most powerful pound for pound muscle in the body. This muscle can't have any, you know, same thing, gristle graininess, no inflammation in here. Right there. Gotta get all that. Can't have any soreness. This.
Right. I grind my teeth. That's why.
You have a mouth guard for that,
I
or?
don't actually. I need to get one. I wear a retainer at night, but I know it's not the same.
Do you think it's stress, or what do you think? Cause can you figure out why?
I don't know. You know, like those guided meditation videos you can use to fall asleep. I always notice they're like, unclench your jaw, and I'm like, and I don't even notice that I'm doing it until I unclench my jaw. So I guess I'm always clenching it. I also like to chew gum. I have gum in my mouth right now.
I got you.
So
The conscious ones we can deal with. I mean, I don't know. My opinion of it is that if it's during the day, I think we can untrain it. If it's at nighttime, it's not clear to me how we're gonna clear that.
yeah.
You know, if it's some unconscious stress or, you know, subconscious, you know, that's a tough one. Right there. Feel that right there?
Yeah, I do.
That's all got to get worked
It
out.
almost kind of tickles.
Yep, there's lactic acid. That's got to get pushed down. You got to push that back down onto the attachment. Yeah, this needs to be worked on.
Yeah, I can tell. I'm like, oof.
There'd be a mark. There'd be a mark right here. I know.
No, that's
I know.
okay. That's okay. If it's gonna help, go for it.
You got to release this is what's keeping a constant pull.
Mm-hmm.
Usually right in here. Okay. I got you. Here we go. Got your leg.
It's funny. It was like the opposite of the.
I wasn't going to say anything. I was like, that was exactly, you got that together. Getting that ankle moved. Nice. All right, toes feel good. Yeah, we just got to work on that quad.
Yeah.
We're going to work on it with the lower back in a second. So we're going to go face down. But right in here, this is where I want to clean this out a little bit.
I sleep on my stomach. Is that?
It's the worst position.
Are you serious?
Yeah.
Oh man.
Yeah. No, we got to get you off the stomach. It's okay. We'll get. Here's the thing. Usually we go to our stomach because other positions are not comfortable, and part of that is like I think of it like a house or a room. Nobody wants to spend time in a room that smells or is glass and is broken TVs. You understand? So we first go in and remodel the room, right? Make it a nice place to be, and your body will reside in it. Does that make sense? So there are places in your back that are, have previous injuries or stress or inflammation, and as we clean out that area, does that make sense? You won't, Ed, I notice I can sleep on my back and I'm not having difficulty anymore. It makes sense? I'm not blaming you for, going on your stomach allows you to avoid things. It's an avoidance posture, and it makes sense that you're wanting to go into avoidance, but we have to try to clear the reasons for why you're trying to get away. And
Okay. Yeah, that makes sense.
yeah.
If not on my stomach, sometimes I'll fall asleep like in a fetal position.
That's
but
the second avoidance position.
Oh, great.
So fetal is the rounded forward position. Is
like very rounded.
correct.
Forward.
Yeah, that's part of it, is to get all the weight off the non-sensitive or off the sensitive structures and put it on the non-sensitive structures. It's we call Antalgia. The issue is that we don't live with our knees on our chest in terms of during our day, right? And so if we stretch at nighttime with our knees on our chest, then when you wake up, your body's, being upright can be difficult, right? Because you just stretch tall forward. So I want to make neutral comfortable. I want to make extension comfortable, and then you can just live your life and not have inflammation when you're, just going about your day.
Right. That is so funny.
Yep.
I did not realize that at all.
It's okay. Yeah, I know. It's the stomach and this fetal is. It makes sense that you want to go to those positions. Those are. They allow you to take pressure off the things that have feeling. They're avoidance postures and.
Ooh.
I know. Yep.
No, that felt good.
All of this got to get cleaned out.
What is that? Just like a knot.
Rotator cuff. Yeah, your
Okay.
rotator cuff, and I want to clean. Can't have any soreness anywhere back here. And there we go. Yeah, feel like a little, just like a graininess, a gristle,
Yep.
to tightness in here. We want to clear all that. A lot tighter on this side. Wow, it's almost a tale of two backs. Your left side, I thought was tight until I came over to this right side.
Oh wow.
It's actually more raised up on the right.
Yeah, it almost like feels more grainy on this side.
Your uterus is under the functional control by your brain. Your brain controls the function of your uterus through two sets of nerves. The lumbar splanchnic nerve is the nerves that form from your lumbar nerve roots, and then you have your vagus nerve essentially that is communicating parasympathetic information to your uterus. And so it's like a gas pedal, brake pedal song that they both sing together. Too much of this, too little of that, and then it's maybe like a tightrope walk. You have to be able to have not too far to the right, too far to the left, or otherwise you fall off the rope. And to me, organ dysfunction happens because you're either going too far left or too far right. You understand? Too much. If you're too stressed out, stress shuts down the vagus nerve. So the nerve that actually tells your uterus how to function, stress shuts that down. Inflammation of your lower back causes what we call the gas pedal, or sort of the brake pedal to your uterus to be activated. So when you're in the fight or flight mode, you don't need to be digesting food. So all of your digestive system, all of your organs, for the most part, other than your heart and adrenals and lungs, most of your organs shut down when you're in fight or flight. You're just trying to get all the blood to go to your muscles and your eyes so you can run and see. There's a false irritation of the sympathetic nerve that tells the uterus to shut down. Now you're having delayed periods. That's why I go back to when you were 12, 13 and your periods were 2 weeks. To me, that's somebody was telling your uterus, hold on, just you understand? And it wasn't allowing everything to flow properly, and so you had a longer lasting period. It wasn't the gas pedal to the organ wasn't functioning properly, so it couldn't just get through it and get it done. It was making it linger and take longer than it should have. And I want homeostasis. I want you to be able to not, need anything constantly. I don't want to be I don't want any of my patients to be, just constantly needing, a third party, I call it, somebody coming in and telling your body how to run its systems. I want freedom, and I don't know how the path that they put us on allows us to get to that place. I want you to be able to be free from these things, and so how do we get there? Well, we call them the 3 T's in chiropractic: thoughts, traumas, toxins. So the thoughts is the stress component, where you have to try to deal with that stress because the stress shuts down the calming systems. Toxins are foods or things that are clogged from lymphatics not flowing, or foods that you put in your body that aren't good. Does that make sense? Toxins. Or you have traumas and injuries, and if you go back to your childhood, I don't know, there's something, trampoline, or there's got to be some or you said gymnastics you did?
I did gymnastics for a long time. I was just a very athletic child. I just tried everything. But gymnastics, dance, volleyball was the main thing for the longest time. That was really what I
indoor or
loved
beach?
To do. Both. I played indoor volleyball and beach volleyball since I was 10 years old, or actually younger than that, 8 or 9.
It can be as simple as something small that makes your back stiff, and then you go drive on a bad alignment. You understand? That'll do it. So it doesn't have to be a large injury if you're dealing with a injury that happened at a young age that then you drove, or it can be a larger injury that but it just it can be tough.
I'm not sure if what I'm about to tell you is considered an injury, but when I was, this is so embarrassing. When I was 12 or 13 years old, I had a good friend that had a birthday party, and we were all dancing. That was when the song "Whip My Hair" by Willow Smith came out, and we were all we played that song over and over and over again, and so we were all whipping our heads around.
Sure, right, that'll do.
I woke up the next morning and I could not get up. I couldn't move my neck. My mom had to take me to the hospital because I thought I was paralyzed. And they put me on muscle relaxers.
Right, which is a silly treatment, right? Jeez.
And I felt so dumb after. I was was it really worth it? No. And every time I hear that song now, I'm I can't. I was I just can't.
Right, so you sprain the joints, and then the muscles go into spasm to protect the joint. That's all that happened. When you whipped your neck around, your lower neck was probably doing a lot of the motion. The lower neck gets a little bit sprained. The muscle relaxant, to me, doesn't allow people to heal the best. The muscle spasm to try to guard an injury. If you get rid of that guarding, now the injured area can keep moving. It's like, but if you just look at it symptomatically and demonize the muscle spasm, it's like, well, the body is trying to protect that area.
Right. The doctor asked, like the ER doctor was like, "Have you done any strenuous activity recently?" and I literally sat there and I was like, I mean, I was whipping my hair around last night. It was so embarrassing.
I think of the L'Oreal commercial,
Yeah.
because I'm worth it.
Yeah, exactly. Oh my gosh. And it's like, it's a funny story for me to tell today, but like, it's so embarrassing that I had to go to the emergency room because of it. It's like, it's ridiculous.
That's when the boyfriend said, "How much is this shampoo?"
Yeah.
Because I'm worth it.
Yeah. Oh my gosh. I know. I was like, I just could not believe it.
All the things we do as kids.
I know.
This right here is not good. There's, I think, a large piece of it right there.
Yep. I definitely feel it. So that's like a muscle.
Well, it's an injury. The left side actually feels pretty good. This is, I would say, is less injured or not injured, and then this side has been injured, and now the left side has to make up for this right side locking down. You don't dive in hardcore, do you?
On the hard floor, yeah.
Oh my gosh.
Oh yeah. No, that's like, those are like, we do drills like on how to like dive.
Those traumas. Those are traumas. Yeah, those are mini traumas.
I consistently had bruises all over me from volleyball because of diving, and it wasn't a big deal to me at the time, but now that I think about it, it's I probably got a lot of injuries from that I thought nothing of before now.
I gotta say to people, if you're gonna be an athlete, you need to have a car mechanic.
Oh yeah, that came up quick.
So as we awaken the monster in here, release the Kraken.
Yeah.
As we release this, this can be a little disheartening because everything sort of gets sore, and now it's even more. But as a process, almost like going to the gym and doing a big workout.
Right.
Okay, you're gonna be a little sore, but as it cleans out, you should see, a marked improvement as the communication lines between your brain and your body start opening up. And this is right where the nerves that go to your knee come from, your quad.
Okay.
L1, L2. This is your quad muscle, and so I'd say that just the inflammation along the side of the spine here is, causing that quad to be, and then probably injuries from volleyball and gymnastics, all this stuff. Even in my own profession, a lot of people just don't kinesthetically touch people. They don't work on anybody. They don't, the medical world doesn't feel. I've asked my dad, why they don't see what we see, and my dad's like, they don't feel the body.
Right.
So they don't feel. When you went to the hospital when you were 12, 13, after you whipped your neck around, the guy didn't go around and just he didn't feel your neck, right?
He didn't.
He looked at you from across the room and said, "Oh, your muscles are probably tight. Here, take this muscle relaxer."
Exactly.
Right?
He just asked me what my symptoms were.
Correct.
Because they thought my mom was afraid it was meningitis.
Right. Oh,
and so that's why we rushed to the hospital.
I know.
But no, it wasn't. I just whipped my hair too much.
I know. It's okay. My wife does that to me all the time. I think it might be bubonic plague, or it could just be an upset tummy.
Oh. So was the fact that my right side being worse than my left, was that associated with like the offset of my shoulders?
Yes.
Okay.
You're contracted down on this side. This is all popped out.
Okay. Interesting.
Bursitis shoulder. The other side of the.
Is anything coming up?
Yep.
Okay.
Yeah, right there on the back side of the shoulder.
I really did not expect that at all. Well, I did expect it, but like how extensive it is, I guess.
Yeah, it came up purple fast too.
Whoa. And I see what you mean now with my neck.
Yeah.
Oh my word.
Toxins. Yeah, we're gonna that lower back on the like I said this area right here.
Yeah.
That has to be. You got to clear all that out of there.
Yeah.
See, part of it is that this area gets congested because of this, and then right below it gets popped out. You're saying because this pushes in and then it pops out the area. That's what then creates a lot of tension in there.
And I see what you mean about this side being worse.
Just gonna arch your back. There we go. Breathe. There we go. Going too hard? You okay?
No, I'm good.
All right. Just keep breathing. Stretching back. There we go. Breathe. Exhale. Good. There you go. Breathe. Good, okay, it's okay. There you go, very good. Too crazy on that. Maybe bring these arms up for me. Bring these arms up. Put your forehead on your forearms. There we go. Take a deep breath in. I got you. Exhale. Let your head relax. There you go. Arch back. There you go. Deep breath in, shoulder, and exhale. Saving that for later. There you go, good. I got you. One more. All right, one more. Exhale. There we go. Let it go. Exhale. Good. There you go. Good. There you go. There you go. Okay. Have you ever had your ear adjusted?
Never. This is gonna be interesting.
Check it.
Okay.
Alright, gotcha. Alright, just go ahead and tilt your head to the left a little bit. There we go, good.
That's crazy.
I got you. Tilt your head to the left a little bit. Okay.
Oh my gosh.
Alright. Tilt your head to the. There we go. There we go, good, okay. That's alright. Probably cleared that one.
Yeah.
Good, okay.
Weird.
Now you put your hand on your hip for me. There we go. And you're sort of gonna just press back into my elbow right here. You're gonna press back. I'm just gonna. There you go. Good. There we go. Same thing. Press back. There we go. Yep. You gotta work on stretching those.
Yeah.
You come out here. I'm gonna have you show you some stretch. Bend both the knees for me. And then you can bring your knees left. There you go. Stretch.
Like all the way?
Eventually.
Even though I'm like coming off a little
Well,
bit.
keep that right shoulder back. I mean, you should be able to rotate without falling off, but yeah. I mean,
Okay.
Bring your knees to the right. Yeah, you've lost a lot of range of motion
Yep.
from that middle back. I know. And keep your knees in the middle for a second.
Okay.
Get the idea. Breathe. Go ahead and move down 1 inch. So you move upwards. You're gonna move higher. There you go. And then you see. So then you move around like by 1 inch, up
Okay.
or down. You bring your knees side to side. We're trying to almost like a drawer, push these drawers in. So sometimes you got to give them a little bit of a wiggle to get them to shut.
Okay.
Okay. So try again. Go knees left, and then breathe in deep, and then exhale. Yeah.